Narrative and communication when discussing spinal manipulation. I was recently teaching on the weekend and I was having a discussion with the students about how communication can have a significant effect on the patient in terms of the techniques that we use. I take spinal manipulation, for example, because it's a very robust technique. It's a technique where the patient feels like things are moving around and you get all these big sounds, cracks and pops sometimes. A lot of social media bastardizes the concept of manipulation in a very biomechanical thought process. There's a lot of misinformation out there. Patients come into clinic with these unrealistic expectations of what manipulation can do. And as a therapist, it's really important that we explain the technique effectively to the patient. But the problem comes where if we don't have effective communication or we're not explaining the technique to the patient as it should be explained, it can have a negative effect on the outcome. So what I mean by that is if the patient comes in and the therapist is saying that they are using manipulation to reposition joints, they're putting things back in place, they are using old school biomechanical concepts of repositioning pelvic structures and correction of leg length, the impression that the patient will get is that there's a vulnerability in the spine, there's a vulnerability in the pelvis, there's the ability for the therapist to use these very small impulses to correct spinal abnormalities or spinal problems to then change the position to reduce pain, which simply is not the case. The patient may think that their spine is weak and fragile, that they don't want to move properly, they don't want to lift weight, they don't want to exercise, because if the therapist can reposition the spine with such a small manipulation, then they obviously are vulnerable. That description, that narrative of spinal manipulation is a negative narrative. If we then flip the coin using the same technique, but we explain it in a way that it's actually a positive framing, the manipulation is what is a therapeutic gapping. It's to help us get you feeling better and moving better, to allow you to exercise and rehab, to get you in that loading phase, because the spine is strong, the spine is resilient. We are not going to reposition the structures because that's not how it works. The spine is incredibly robust, and we're just here to manage your symptoms, to allow you to create tissue resilience, to get on with your life, and to create ultimately as much pain-free movement as we can through exercise and rehab. And manipulation is only a small part of that treatment process. Same technique, but described to the patient in two different outcomes. One creating patient vulnerability, one creating patient confidence. So it's important that we choose the right narrative. It's important when we talk to our patients, we have effective communication, because if we sit there looking at Instagram and all these Instagram manipulation gurus popping things back in place and talking utter nonsense, the patient is going to have an unrealistic expectation of what manipulation can do, will do, and ultimately, if they believe the patient that the therapist can pop the joint back in that easily, we're going to increase the concept of spinal vulnerability, which is ultimately not the case. So the key is, guys, let's be better, let's communicate better, let's make sure we push a positive narrative. Boom.